Diabetes type 2, what is it? When you eat, your digestive system breaks the food down into sugar, glucose, and your bloodstream delivers the sugar to the cells throughout your body. Your pancreas makes insulin, which helps break down the sugar. Diabetes develops when your body does not develop enough insulin, or when your body has an intolerance to insulin. That's called insulin resistance. This results in the sugar in your bloodstream becoming too high. This is because without enough insulin, or if your cells are resistant to insulin, the sugar builds up in the bloodstream. This can be dangerous if it is not treated. The goal of treatment is to keep the blood sugar at a steady level. This most often happens to people who are over 40 years old, overweight, whose parents may have had diabetes, or people who have had large babies or developed just diabetes during pregnancy. Most often when people develop diabetes in later life, it's type 2 diabetes. It's important you know the signs and symptoms of diabetes: age, weight, healthy diet. These are important causes of diabetes. When these things happen, your cells can become unable to intake the sugar. What are the symptoms of diabetes? How is it found? Often people with diabetes need to urinate frequently. They become very thirsty.
They may gain a lot of weight or lose weight. Your vision can become blurry. You could have infections, fatigue.
Most people have no symptoms before being identified with diabetes. There are various tests that one can look at to check the level of sugar in the bloodstream. One test is called the fasting plasma glucose test. After fasting overnight, one will take a test and measure the amount of glucose in the bloodstream. Often it will test a second time. This would be fasting after your evening meal and testing the blood in the morning. This is OTT, the oral glucose tolerance test. So you would not eat anything after eating the night before, and your blood would be tested, and then you would drink some sugar, and 2 hours later the sugar in the bloodstream would be measured. If it's more than 200, you might be identified with diabetes. For treatment, one learns to control the level of sugar in one's bloodstream to keep the level in a normal range. This is done by measuring the blood frequently. Take medications on time. Check your sugar, glucose,
your blood sugar level.
Using a paper strip and testing it in a machine that can measure the blood sugar level. You could prick your finger and place the blood on a test strip. The doctor will teach you how, when, and how often to test your blood. When you have diabetes, it's important that you test your blood often and keep that blood sugar at a level range. Your doctor will set up an appointment and teach you how to take care of your diabetes and how to be successful at that. There's a blood test called the hemoglobin A1C that you can use to check your average blood sugar over time. Remember, it's important to observe good habits daily, being careful with the amount of sugar you have and keeping your blood sugar in the normal range. You can get a checklist. It's important that you choose healthy foods and keep your weight in a normal range. That will help you lose weight. You may want to lose 8 to 10 pounds and may eliminate your need to take additional medications. It's also important that you get regular physical exercise. This will help use up more sugar in your blood and use insulin more efficiently. Ask your doctor about what exercises might be good for you to do. Medications. It's very important that you control your blood sugar to help lower your insulin is used when diet, exercise, and other medications are not enough. Insulin's available in different forms. You can be taken through injections. Your doctor can teach you how to self-inject. You may need to inject yourself with insulin 1 to 4 times a day. It's important that you work with your doctor and explain and learn how to follow the directions. This will help you keep control of your diabetes and avoid dangerous consequences of high blood sugar.
Diabetes type 2, what is it?